Hey everyone, welcome to our deep dive all about renal cell carcinoma.
That's right, we're digging into this Assay Genie article, Renal Cell Carcinoma, Understanding, Diagnosing, and Treating Kidney Cancer.
We're going to make this your one-stop shop for RCC.
Everything from what it is to the risks.
How it's diagnosed and all the latest treatment options.
We'll make sure you leave here feeling informed, not overwhelmed.
Absolutely. So let's jump right in. RCC. What are we talking about here?
The RCC is the most common type of kidney cancer.
Oh, wow.
It makes up about 90% of all kidney cancer cases.
Okay, so that's a significant majority.
Yeah, and it usually starts in the lining of those tiny tubes in your kidneys
Okay.
called the proximal renal tubules.
I see. Not just anywhere in the kidney, it's got a
Yeah.
specific
Yeah.
origin point. That's interesting.
Yeah, it's very specific. And, I remember reading that RCC can be pretty sneaky.
Yeah, that's concerning. I imagine that makes diagnosis tricky.
It's true. A lot of
Oh.
times in the early stages, there aren't any symptoms.
So then how do you even know what type someone has if there's no obvious symptoms?
Well, there are actually different types of RCC,
Oh,
and each one has unique characteristics.
Mhm.
Like we classify them by how they look under a microscope and also by their genetic profiles.
so it's not just a one-size-fits-all RCC?
Not at all. The most common type is called clear cell RCC, and that's often linked to mutations in a gene called VHL.
Oh, interesting. I think I remember seeing that in the article.
Yeah, it's pretty fascinating that this gene normally acts as a brake on cell growth.
Okay.
But when it's mutated, it can lead to uncontrolled cell division and tumor formation.
So it's like the body's safeguards are malfunctioning?
Exactly. Even our own cells can kind of turn against us when these intricate regulatory mechanisms go wrong.
That's,
It's a little scary,
yeah, it's a little scary.
but important to understand.
Yeah. And I remember you mentioning that there's more to risk factors than just like the usual suspects like smoking.
Right.
What else increases someone's risk for RCC?
Well, you're right. Smoking is a big one. Obesity and high blood pressure also increase your risk. But there are also some genetic syndromes that can really increase a person's risk.
Interesting.
Like on Hippel-Lindau disease.
Yeah, I remember that name from the article, but I don't remember too much about it.
It's rare, but it's a good example of how genetics can really play a role in cancer development.
Yeah, for sure.
So basically, in this syndrome, mutations in that VHL gene we talked about are inherited. So that makes individuals significantly more susceptible to developing RCC.
Oh, wow. So it's like a double whammy,
Exactly.
having a faulty gene and then, lifestyle factors piling on top of that.
It really highlights how our genes and environment interact to shape our health.
Right. That makes a lot of sense. You also mentioned workplace exposures.
Right.
What kind of jobs would put people at higher risk?
So prolonged exposure to certain chemicals like cadmium or organic solvents, that can increase the risk. Think people who work in industries like battery manufacturing or certain types of chemical production.
Oh, so like industrial settings.
Exactly. Not something most people would immediately think of.
Right. It's a hidden danger.
Exactly.
So if RCC is so good at hiding, what should people be on the lookout for?
Well, the most alarming sign is blood in the urine,
Wow.
hematuria.
I bet that sends people straight to the doctor.
Yes, you would hope so.
Are there other signs that maybe aren't as dramatic to watch out for?
Absolutely. Persistent pain in the side of the abdomen. Lower back pain or feeling a lump in the abdomen could be signs.
Okay.
Unexplained weight loss is another common one.
Yeah.
And then fatigue, which unfortunately can be pretty general and easily dismissed.
Right, right. So it's about paying attention to our bodies and noticing those changes that seem off.
Exactly. Early detection is key.
Yeah. Okay, so let's say someone does notice these symptoms and goes to the doctor.
Right.
How do doctors actually confirm a diagnosis?
It can be tricky. Imaging is vital. They'll usually start with an ultrasound to get a general overview of the kidneys.
Okay.
But the gold standard for diagnosis is a CT scan.
So that's the go-to tool.
Exactly. It provides a much more detailed view of the tumor, its size, and its location.
Okay. And now I know biopsies are common for a lot of cancers.
Right.
Is that the same case with RCC?
It's interesting you bring that up because biopsies are standard for a lot of cancers, but they're actually less common with RCC.
Oh, really?
Yeah. And that's because there's a slight risk of spreading the cancer cells during the procedure.
Oh, I see. So it's really a judgment call based on the risks and benefits.
Exactly. Patient safety is always paramount.
For sure. Okay, so let's say RCC is diagnosed. What happens next? How do you figure out the best course of treatment?
That's where staging comes in.
Okay.
There's like a roadmap that guides the entire treatment plan.
Interesting.
Doctors use what's called the TNM system.
Okay.
And that takes into account the tumor size, that's the T,
Okay.
whether it has spread to nearby lymph nodes, that's the N,
Gotcha.
and whether it has metastasized or spread to distant organs,
Mm-hmm.
and that's the M.
So basically the T&M system tells you how far it spread.
Exactly. It helps doctors assess how serious the disease is and how to tailor the treatment.
I'm guessing the higher the stage, the more serious it is.
Yeah, Stage 1 is the most localized.
Okay.
So the tumor is confined to the kidney.
Okay.
And then as the stages progress, it means the cancer has spread further, with stage 4 being the most advanced,
Right.
meaning it has spread to other organs.
Gotcha. So understanding the stage is like knowing the enemy's position.
Precise.
It helps you strategize. So what weapons are in the arsenal? What treatments are available for RCC?
Good news is we've got a variety of treatment options.
That's good.
And the choice really depends on the stage of the cancer and other factors specific to each patient.
Okay.
So for localized RCC, where the tumor is still just in the kidney, surgery is often the first line of defense.
So they try to get it out before it spreads.
Exactly. There are two main types of surgery: partial nephrectomy,
Okay.
where they just remove the tumor and preserve as much of the kidney as they can,
Okay.
and then radical nephrectomy, where they remove the entire kidney.
So they choose the least invasive but still effective approach.
That's the goal.
Okay, but what if it has spread beyond the kidney? What happens then?
When RCC is more advanced, we might use targeted therapy.
Ooh, this is where it gets really interesting.
Okay.
Tell me more about these targeted therapies.
So one type is called tyrosine kinase inhibitors,
Okay.
or TKIs.
TKIs. Got it.
Think of them as like cutting off the fuel supply to the tumor.
Oh, wow.
They block specific proteins that help the cancer cells grow.
So they starve the tumor.
Exactly. And then there are mTOR inhibitors,
Okay.
which target a different pathway involved in cell growth.
Okay.
They disrupt the signals that tell cancer cells to grow and divide.
So both of those are aimed at stopping those cells from growing.
Precisely.
And I know immunotherapy is also a big thing in cancer treatment these days.
It is.
How does that work with RCC?
Immunotherapy is fascinating, and it's making huge strides in RCC treatment. The idea is to boost the body's own immune system to fight the cancer.
Okay.
One of the key players here is what's called checkpoint inhibitors.
Checkpoint inhibitors. Okay. I'm intrigued. Tell me more.
Our immune systems have these built-in checkpoints
Okay.
that basically prevent the immune system from attacking healthy cells.
Gotcha.
But cancer cells can actually kind of exploit these checkpoints
Really?
to evade the immune system's surveillance.
Oh, wow. So they're sneaky.
They are. So checkpoint inhibitors like nivolumab,
Okay.
they work by releasing those brakes,
Okay.
allowing the immune system to recognize and attack the cancer cells.
So it's like you're removing the camouflage that the cancer cells are using.
Exactly. It empowers the body's own defenses.
That's so cool. What about radiation? I know that's common for a lot of cancers.
Radiation is effective for many cancers, but RCC is pretty resistant to it.
Oh, really?
Yeah. It's not usually the primary
Yeah.
treatment, but it might be used to manage symptoms like pain from bone metastases
Okay.
or to provide palliative care.
So really just to improve quality of life.
Exactly.
Gotcha. But there are other less invasive options too, right? Like for treating smaller tumors?
Yes, there are things like ablation techniques. Cryoablation and radiofrequency ablation, or RFA, are two common ones.
What do those do?
So cryoablation freezes the tumor,
Wow.
and RFA uses heat to destroy the cancer cells.
Interesting.
They're both minimally invasive alternatives to surgery for those smaller tumors.
It's fascinating how many different treatment options there are.
It is.
But I know a big question for people facing a cancer diagnosis is what's the prognosis?
Right.
What are the chances of survival?
It's a tough question, but important.
Yeah.
The good news is that early stage RCC, especially stage 1, has a very high survival rate,
Well, that's good.
around 80–90% 5-year survival.
Wow, that's really reassuring.
Yeah.
But what about more advanced cases?
For metastatic RCC, where the cancer is spread, the survival rates are lower.
Okay.
However, targeted therapies and immunotherapies have really improved outcomes in recent years.
Well, that's good to hear that there's still hope.
Definitely.
It seems like RCC research is constantly moving forward.
It is.
Are there any promising developments on the horizon that you're excited about?
Absolutely. Liquid biopsies are one.
Okay, liquid biopsies. I've heard that term.
Yeah.
What does that mean exactly?
Imagine monitoring cancer without any invasive procedures.
Okay, yeah.
That's what liquid biopsies can offer.
Wow.
Instead of doing a tissue biopsy, they analyze what's called circulating tumor DNA.
Oh, wow.
or ctDNA in the bloodstream.
So just a blood sample can tell you about the cancer?
Exactly. And it's like
Yeah.
a window into how the tumor's responding to treatment.
Oh, that's incredible.
Yeah, and by tracking those ctDNA levels over time, doctors can personalize treatment plans and make adjustments as needed.
Wow, that's revolutionary. Are there other groundbreaking therapies being explored?
While another area with immense potential is CAR T-cell therapy.
CAR T-cell therapy. I've heard it called a living drug. What does that even mean?
So they take a patient's T cells, which are a type of immune cell,
Okay.
and they genetically engineer them to recognize and attack specific cancer cells.
Oh, wow.
So it's like training a special forces unit of the immune system to target the tumor.
That's incredible. It sounds like science fiction coming to life.
It's still in early research stages
Okay.
for solid tumors, but the initial results are promising.
Wow.
Definitely challenges to overcome.
Yeah,
But it has the potential to be a game changer for folks with advanced RCC.
that's really promising. Any other promising research areas you're watching?
Well, one more area that's gaining a lot of momentum is combination therapy.
Okay.
The idea there is to combine different types of treatments to boost their effectiveness.
Okay, I see.
For example, combining checkpoint inhibitors with TKIs or MTOR inhibitors.
So it's like hitting the cancer with multiple weapons at the same time.
Exactly. And early data suggests that these combination approaches can lead to even better outcomes.
That's great news, especially for those with advanced RCC.
It is.
Okay, so we've covered a lot today. Can you give us a quick recap of the key takeaways about RCC?
Sure. So RCC is the most common type of kidney cancer, and it often goes undetected in those early stages.
Right.
We talked about the risk factors,
Right.
things like smoking, obesity, family history, and exposure to certain chemicals.
Yeah.
We also talk about the common symptoms like blood in the urine, flank pain, and unexplained weight loss.
Exactly. And the importance of imaging for diagnosis.
Yes.
Especially those CT scans. And
Exactly.
we talked about the staging system and
Yeah.
treatment options from surgery to targeted therapy and immunotherapy.
Right. And then we also touched on those exciting advancements in research.
Yeah, the liquid biopsies, the CAR T-cell therapy, and the combination therapies.
Exactly.
It's clear that while RCC is serious,
Yes.
there is a lot of hope and progress being made. What I find really fascinating is how much we've learned about cancer in general.
It is amazing.
It's not just one disease, but a whole spectrum of diseases, each with its own quirks and challenges.
Absolutely. And that's why this research is so vital.
Yeah,
The more we understand about those specific mechanisms driving each type of cancer, the better we can tailor treatments to each patient.
that's such a good point.
Yeah.
I think this deep dive into RCC has not only given us great info about this type of cancer,
Right.
but also shown the amazing progress being made in cancer research as a whole.
It really underscores the importance of early detection, understanding those risk factors, and getting medical help if you have any concerning symptoms.
Yeah, because the sooner you catch it, the better your chances.
Exactly.
It's about being proactive and informed about our health.
Well said.
This has been really enlightening, wouldn't you say?
Absolutely. It's always great to explore these complex topics and highlight the newest advancements.
Yeah,
It's amazing what we can accomplish with science.
it really is. And that concludes part 1 of our deep dive into RCC,
We'll be back for part 2.
where we'll go even deeper into the treatment approaches and explore those advancements in more detail.
So be sure to tune in.
See you then?
Love it. Welcome back to our deep dive on renal cell carcinoma. Before we move on, I want to circle back to that concept of combination therapy.
Yeah.
We touched on it briefly before.
Yeah, I'm curious about that too. It makes sense to hit the cancer from different angles, but what are the specifics? Like, how do these combinations actually work?
So it's all about using different mechanisms of action
Okay.
to really enhance the response and overcome any resistance.
Okay, so how does that actually work?
Think of it like this. Cancer cells are tricky,
Okay.
they evolve, and they can figure out ways to evade treatment.
Oh, so they adapt,
Yeah, exactly.
like a chameleon.
Exactly. So that's where combination therapy comes in.
Okay.
By using multiple treatments that target different pathways, we can outsmart those cancer cells.
Oh, that's interesting. Can you give me an example of how that works?
Sure. So checkpoint inhibitors, we talked about those.
Yeah.
They work by unleashing the immune system.
Right.
But sometimes the tumor can actually suppress the immune response.
Oh, wow. So it's like the cancer cells are building a fortress.
Exactly.
Yeah.
And that's where targeted therapies come in.
Okay.
They can help break down those defenses
Okay.
and make the tumor vulnerable.
Gotcha.
For example, TKIs can inhibit certain signals that promote tumor growth
Yeah.
and also immunosuppression.
Okay.
So by combining a TKI with a checkpoint inhibitor, you're basically hitting the cancer from two sides.
So it's a 1-2 punch?
Precisely.
I like that.
Yeah.
So are there other combination strategies?
Absolutely. A lot of research looking at different combos,
Okay.
not just TKIs with checkpoint inhibitors, but MTOR inhibitors with checkpoint inhibitors,
Okay.
even triple combinations.
Wow.
It's a really exciting field,
So many possibilities.
and we're learning more all the time.
And that's where personalized medicine really comes in, right? Using genetic testing and tools like that to figure out what's best for each person.
And those liquid biopsies we talked about,
Right.
those play a crucial role in personalizing treatment.
Okay, cool. So you mentioned before that there are different subtypes of RCC,
Right.
with clear cell being the most common. What are the key characteristics that make those subtypes different?
Great question. Understanding these subtypes is so important
Okay.
for making treatment decisions.
Gotcha.
So let's start with clear cell RCC. It gets its name from how it looks under a microscope.
Okay.
The cells look clear because of the buildup of lipids and glycogen,
Interesting.
and it's often associated with mutations in that VHL gene,
Right.
which normally suppresses tumors.
Okay. What about the other types?
So papillary RCC, the second most common,
Okay.
it's characterized by cells that form these finger-like projections,
Mm-hmm.
or papillae,
Papillae. Okay.
and it tends to grow more slowly than clear cell
Okay.
and is less likely to spread.
So less aggressive.
Generally, yes.
Okay.
But there are different subtypes of papillary RCC,
Right.
and some can be more aggressive.
So it really depends.
Exactly.
Gotcha.
And then we have chromophobe RCC, which is less common
Okay.
and generally has a better prognosis.
Okay.
The name comes from its appearance under the microscope.
Okay.
The cells don't absorb dyes well, so they stain pale or chromophobic.
So each one really has its own distinct look,
Yeah, they do.
and that helps doctors decide on treatment.
Absolutely. It's like treating different animals.
Right.
You wouldn't treat a lion the same way you'd treat a gazelle.
That's a good point. And staging also plays a big role, right?
Definitely. It's crucial.
Can you walk us through the stages and explain what they mean for patients?
Sure. So staging is like assessing the damage after an earthquake.
Okay.
We use the TNM system,
Right.
which stands for tumor, node, metastasis.
Right. We talked about that before.
Exactly.
So it describes how far the cancer has spread.
Exactly.
What does that actually mean for treatment?
So stage 1 is the earliest. Okay. The tumor is small and confined to the kidney.
Okay.
Surgery is usually the primary treatment, and the prognosis is very good.
So stage 1 is the best case scenario.
Pretty much.
Okay. What about the other stages?
So stage 2 is similar,
Okay.
but the tumor's larger.
Okay.
Surgery is still the first line of treatment,
Okay.
but there might be a higher risk of it coming back.
Okay. So size matters.
It does.
Yeah.
And then in stage 3, we start to see lymph node involvement,
Oh, okay.
meaning the cancer has spread to nearby lymph nodes.
So it's not contained anymore.
Right. And it might have also invaded nearby blood vessels.
Oh, so that's more serious.
It is. And treatment for stage 3 usually involves a combination of surgery, targeted therapy, and maybe immunotherapy.
Okay.
The goal is to get rid of as much of the cancer as possible.
Yeah.
And then use those additional therapies to target any remaining cancer cells.
Okay. So it's multi-pronged.
Exactly. And what about stage 4? What does that mean?
Yeah. What happens then?
Stage 4 is the most advanced stage, meaning the cancer has spread to distant organs like the lungs, bones, or liver.
Oh, wow.
Treatment in this stage is focused on controlling the cancer and improving quality of life.
So not necessarily curing it at that point.
Unfortunately not. But we've seen big improvements in survival rates for stage 4 RCC,
Okay.
thanks to those advances in targeted therapy and immunotherapy.
Well, that's good to hear. Gives people hope.
Definitely.
Now, I know every treatment has potential side effects.
Right.
What are some of the common ones with RCC treatments?
It's really important to talk to your doctor about the risks and benefits of each treatment option,
Yeah, for sure.
so you know what to expect. The side effects can vary.
Okay.
Surgery can have bleeding, infection, or damage to surrounding organs.
Okay.
Targeted therapies can cause fatigue, diarrhea, high blood pressure, skin rashes, and immunotherapy.
Right. Because that works differently, right?
Right? It activates the immune system.
Right.
And sometimes this can cause an overactive immune response.
Oh, so it kind of backfires a bit.
In a way, yes. It can cause inflammation in various organs.
Oh, wow.
These are called immune-related adverse events.
Okay.
And they can affect the skin, lungs, gut, liver, and other organs.
So it's like the immune system is attacking healthy tissues too.
Yeah, sometimes. But these side effects are often manageable with medication and monitoring.
Yeah, okay.
And for a lot of patients, the benefits of immunotherapy are worth it.
Right. It's a balancing act.
Exactly.
Weighing those benefits against the risks.
Exactly.
That's where personalized medicine is so helpful.
Definitely.
So what's the main message you want listeners to take away?
Knowledge is power.
Mm-hmm.
The more you know about RCC, the better decisions you can make about your health.
Right.
Ask questions, get second opinions,
Yep.
advocate for yourself.
It's your health.
Exactly.
Mm.
And there's always hope.
That's so important.
We've seen so much progress in RCC treatment,
It's amazing.
and there's reason to be optimistic.
Awesome. Well, we've covered a lot in this second part of our deep dive into RCC. We've talked about combination therapy, different subtypes, staging, and side effects.
Right.
We'll continue our exploration in part 3
Yes, we will.
and delve into the future of RCC research and all the exciting things on the horizon.
Looking forward to it.
See you then. And we're back for the final part of our deep dive into renal cell carcinoma. It's been quite a journey, wouldn't you say?
Absolutely. We've covered a lot of ground, from the basics to the really complex stuff.
Definitely. Now I'm really curious about the future of this field. What breakthroughs are you most excited about? What's on the horizon?
The future of RCC research is incredibly promising. We're on the verge of some major advancements that could change everything. One area I'm particularly fascinated by is genomics.
Genomics. Okay. I know it has something to do with genes, but remind me how that relates to cancer research.
Of course, genomics is the study of all of an organism's genes, its genome. And in cancer research, it helps us understand the specific mutations that make a tumor grow and spread.
So it's like having a blueprint of the enemy's defenses.
Exactly. It's all about personalized medicine, really.
Mm-hmm.
By identifying those genetic vulnerabilities, we can develop drugs to target them.
So more effective treatment and fewer side effects.
Precisely. We're already seeing this with some therapies, like the TKIs and mTOR inhibitors, but genomics opens up a whole new world of possibilities.
It's like having a key that unlocks a specific door rather than just trying to break down the wall.
A perfect analogy.
So genomics is revolutionizing how we understand cancer at its core. What other exciting areas are out there?
Immunotherapy is another one that's booming with innovation. We talked about checkpoint inhibitors, but research is going even further.
How so?
Exploring ways to train the immune system to attack cancer cells with even greater precision.
That's incredible. What approaches are you most optimistic about?
One very promising area is personalized cancer vaccines.
Wait, personalized cancer vaccines? That sounds like something out of a movie. How does that even work?
They'd be custom made for each patient, using their own tumor cells or antigens.
Wow. And that would stimulate their immune system?
Exactly. To mount a targeted attack.
It sounds futuristic. How close are we to actually seeing these vaccines?
Closer than you might think. There are trials already underway for various cancers, including RCC, and the initial results are looking good.
That's amazing. Imagine being able to prevent cancer from coming back with a vaccine. So what other futuristic technologies are we looking at?
Nanotechnology is another big one. These tiny particles, engineered at the nanoscale, can deliver drugs right to the cancer cells.
So less damage to healthy tissue.
Exactly. Fewer side effects, too. It's like a microscopic delivery system.
Like a guided missile for cancer treatment.
Exactly. And it goes beyond drug delivery. Nanoparticles can also be used for imaging and diagnostics.
Wow. So we can see and detect cancer cells more accurately.
Exactly. The possibilities are truly incredible.
It feels like we're entering a new era of cancer treatment. More precise, more personalized, and definitely more effective. And it's not just about treatment, it's also about preventing it in the first place. What's happening in RCC prevention research?
Lifestyle plays a huge role. We know things like smoking, obesity, and high blood pressure increase the risk. So promoting healthy habits is crucial.
Empowering people to take control of their own health.
Absolutely. And beyond that, research is looking into the role of genetics and environmental exposures.
To identify those who might need early screening or preventive measures.
Exactly.
It's incredible how research is shedding light on all these different aspects of RCC, from the tiniest molecule to the individual, even the entire population.
It's a massive collaborative effort. Scientists, doctors, patients, advocates, all working together to find a cure.
It's inspiring to see that dedication. I'm leaving this conversation feeling hopeful about the future of RCC treatment.
The progress we've seen is truly remarkable, and there's even more to come.
To our listeners, we encourage you to keep learning and stay informed about the latest advancements. Knowledge is power.
And never lose hope. With the research and the new treatments, the future is bright.
This has been a truly enlightening deep dive. Thank you for joining us. Stay curious, stay informed, and most importantly, stay well.